Hi there, I'm Janelle Marie. Welcome to Body Beautiful, the show where we talk with local professionals about the latest in cosmetic procedures and medical devices. With us today, we have our favorite plastic surgeon, Dr. Joseph Mealy. We love you here.
Thank you.
We're talking about a couple different procedures. First up, we've got mommy makeover, breast augmentation and lifts, Brazilian butt lifts. Obviously very good. We've got to hear all about those. And then thigh lifts. Lots to talk about. Very popular, yes, but we're not going to start with that.
Okay.
And before we get started, you guys, any advice we give you today, consult your physician, but let's jump right in and talk about mommy makeovers. Summer's here.
Yes, it is.
Everybody wants to look good, right? Out, less clothing. But mommies aren't just going in for mommy makeovers. So who's a good candidate? Because we want to make sure, you don't just have to go because you're a mommy.
Sure.
Other people can go.
Well,
so what is it?
The term originated because postpartum, after having kids,
right,
the breasts, the bellies kind of take a hit. They get
right,
bigger during pregnancy or breastfeeding and then get smaller and sometimes sag. So a mommy makeover was created to sort of restore those two areas. So it's a combination of a breast enhancing procedure and something with the belly.
So breast and belly, can you do liposuction with it? Is it a breast lift or augmentation? Or you just kind of, that person comes in and you figure out what they need?
It's like every other procedure. It needs to be tailored to whatever the problem is. So if someone has good looking breasts or just small, then usually a breast implant will enhance the size and keep a good shape. With the belly, if there's just a little bit of fat, then liposuction takes care of it. But as the skin becomes loose, then other procedures need to be done. It can be anywhere from mini tummy tucks to full tummy tucks, just depending on how much skin redundancy there is and how much stretch there's been, not only to the skin, but the muscle underneath.
And so how do you know mini tummy tuck from full tummy tuck?
The simple way to do it is if you put your hand over your belly button and the area below that, and everything above the belly button looks like you want it to, then probably a mini tummy tuck will take care of it. But if there's loose skin above the belly button or the muscles pooching out there, probably need a little bit more.
And that's
the more normal case.
The big one.
Yeah.
And that's where you have to kind of tighten the muscles too.
Exactly.
Okay.
And that's really helpful because the muscles are the foundation, and if they're not tightened, even if everything over is soft and tight and thin, it's still going to look round.
And what about time off? How much time do you need off?
It's a lot like any sort of abdominal procedure. So if we're doing hernia repairs, usually tell people not to lift anything heavy for 6 weeks.
Okay.
It's the same for tummy tucks. But in terms of getting up, walking, as you can tolerate it, you can do it.
Let's take a look at our first picture because we'll show the scars too, because I want to talk about those as well.
Okay.
What did you do here?
So here's someone who had both the breasts and the bellies.
Very beautiful after picture.
She had a lift to move her nipple up a little bit on the breast.
No augmentation, just a lift?
Oh no, with an implant.
With an aug, okay.
Because the implant's necessary to get the volume a little bit bigger.
Gotcha.
And then the belly, obviously, we've tightened the muscle.
That's wonderful.
So you can see the shadow from the rectus is pulled towards the middle, and then the stuff in the middle that was sticking out is flattened.
And no loose skin. You can see that there was kind of crepey skin on the side. That's gone.
And that's the beauty of this procedure is it takes care of the muscle, the skin, and the fat at the bottom part. So.
And scars for these?
So the scar runs at the bottom, so it's in the, trying to keep it below the belt line.
Yeah.
So then even in a bikini, it can be hidden well.
Yeah. So even if it hasn't faded yet, you can still go to the beach, hide it behind your or underneath your bathing suit. Here's picture number 2.
And in this case, you would do the periareolar lift, so the scar is right around the areola.
Say that again.
Periareolar. Yeah. The areola is that pigmented skin around the nipple, the brown stuff. And then the belly did a tummy tuck there too. And for her, maybe a mini would have worked, but she had a lot of stretch marks. So we're trying to get rid of the maximum amount of skin. So I want to remove as much skin as possible.
And stretch marks, you see a lot of that obviously with the mommy makeover, right? And so a lot of women want those gone. And
if they're below the belly button, that skin goes away, so it goes away.
Nice. Picture number 3.
Same thing here again. With the lift, did breast augmentation, and you can see that loose kind of crepey skin on the belly before. Yeah, that gets taken away. Just tightens it right up.
That is wonderful.
So, and it's in conjunction with diet, exercise, all that sort of stuff too.
And last photo here?
So here a little bit more, and you can see where the scar is. So in her case, the skin's really starting to fold over at the bottom. I was able to do some liposuction to the sides, tighten up the muscle, tighten up the skin. That scar is low, so when she's wearing pants, you don't see it.
Is that an augmentation on this one?
Also had augmentation with a lift.
Now, do you do all these procedures together under local, general, what?
Under general, yeah.
Under general?
Think I want to try it under
not local. I didn't mean that. But
I can't say it's never done, but it's not usually done that way. But general anesthesia is nice because medicine goes in the IV, and the next thing you know, you're done.
You're done.
So that whole part in the middle, you don't have to worry about.
And you can get them all done 2 or 3 at the same time.
We can, yeah. You have to be healthy, though. If you're not healthy, then you don't even want to do one at a time.
Absolutely.
But if someone's healthy, most women who've had children have already had a stress test because they were pregnant, and we know they're going to survive.
Wonderful. All right, for more
important.
information about Dr. Mealy, right here, 925-943-6353. That's his office, or you can check him out on the web at either drmealy.com or sanfranciscobreast.com. And all the pictures that you're seeing here, you can see online, right? You can go and look at all the before and after pictures. All right, lots more to come about plastic surgery. We're going to see a lot more before and after pictures. Talk to Dr. Mealy. We'll be right back on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.